So the basic difference we need to understand when we need to do screening and when we need to do assessment. So anyone is having any sort of idea about it? Are they mean same thing or something is different about it? Fine. So we need to understand those things. So screening is basically done to prevent the things. So fine. So when we used to study or when you guys are studying about rehabilitation, so and preventions and that, fine. So there are something known as primary, secondary, and tertiary level of preventive measures. Fine. So that is one thing. So whenever we are talking about screening, we need to understand we are trying to prevent any form of injuries. However, in assessment, the things are quite different. I will request everyone to kindly mute. Someone is trying to say something. Fine. So we'll have a discussion at last. Fine. So screening is basically done whenever we want to look upon the disease to prevent it or any sort of pathological conditions. Fine. So there's something known as injury prevention program. So that is basically done to prevent any sort of injury. But to go to that state, we need to understand how we need to do a screening. Fine. So basically, whenever we are talking about any form of injuries or any form of injuries, moreover, we need to understand how these injuries are going to get occurred. Fine. So this was one of the criteria given by WHO, in which we need to understand that any injuries or any form of pathologies that we can able to detect in any form of early stage, that we can able to prevent it, and there has to be certain sort of suitable test to prevent it, isn't it? In that in mind, in sports point of view, how can we prevent those injuries, and we need to understand those things. So to prevent any sort of injury, we need to formulate a series of methods. Fine. Suppose, for example, if you want to take any sort of injuries are basically of two types. Fine. One is your overuse injury, one is your traumatic injury that we know. So overuse injuries are certain things in which there will be a repetitive wear and tear of any tissues causing some sort of pathological changes. So to prevent those things, we can able to do certain sort of test. But however, as per the research and literature, as of now, there is no as such any sort of screening test available right now to predict any form of injuries or to investigate or to do any sort of things on that. However, we can work on certain things like, so if you see injury from the pathological point of view and a biomechanical point of view, if suppose for example tennis elbow, fine, tennis elbow is also known as lateral epicondylitis, or so in which ECRL, the muscles, is going to going to have a certain sort of wear and tear. So if we know that there are certain activities that is going to cause that sort of changes in that particular tissue, we can able to work upon those particular structure. For example, in case of tennis or badminton, this wear and tear will be too much in that muscle, be it any sports in which twisting activities are required and much more of wrist extension. In fact, as we know that these activities will be too much, so if we can able to understand that how much that muscle is weak, okay, with the help of any sort of objective test in which there are certain sort of outcome measures are there, and in case if any musculature are tight or not, if we can able to do that, um, then we can able to understand that that particular person or any subject is having a X amount of strength in that particular musculature. Through that, we can able to do certain sort of preventive measures if we can able to train on that muscles. That's why if you see all these injury prevention programs are tailored into that space in which there will be much more of mobility form of exercises, stability form exercises, flexibility, and then strength training on that. That is basically done to prevent any sort of wear and tear in that particular muscle. Fine. Be it any sort of case. For example, in concussion, fine. So we don't know that concussion is a traumatic injuries, and we don't know that when it is going to get occur. Fine. So to prevent the extent of coup and counter coup mechanisms and all those things, counter coup mechanism, we need to work on our neck musculature strengthening. Fine. So in the neck areas, there are so many muscles are there. Fine. So upper trapezius, levator scapulae, or be it splenic. Fine. So we need to work on those muscles. And if we work on upper back muscles and neck muscles over there, and we can able to measure any sort of strength over there, or if there's any sort of tightness, we can able to prevent the extent of I would say rather extent of that pathological changes. Fine. Although it's a traumatic injury and poop mechanism and this other mechanism still going to occur on that. Fine, causing changes in our functionality of the brain in case of concussion. However, in much more musculoskeletal conditions like a growing injury, there are so many protocols. Like a Copenhagen protocol is there for growing injury. So we can able to do all those things. These protocols are made in that way only that we are going to strengthen that muscles over there in a growing area, like adductors and all. So be it any sort of musculature, okay, we can able to do certain sort of program tailored to that to prevent the injury, but we are not sure that whether the injuries are going to occur. Fine. So there's no way that we can able to predict the injuries, but however we can make a certain sort of injury prevention program through which we can work on strength training, flexibility, mobility, and all those stuff. However, we do need to understand that there's something known as pre-participation evaluation or preventive health evaluation or pre-participation examination that is going to look upon all the historical data from all the system wise. Fine. Apart from your sports history and different sort of histories will be there, cardiovascular, musculoskeletal, and through which we can able to map certain sort of outcomes, and depending upon that we can also create a certain sort of injury prevention program also or rehabilitation program depending upon any sort of outcome. So that is about the screening. Screening is basically done to look upon the any sort of wear and tear if it is there, and through so many means we can able to prevent that thing. That is known as injury prevention program. And this is how the screening, the basic agenda of screening is. To design a screening program, we need to formulate a certain sort of hypothesis. Hypotheses are basically assumptions. We need to have a certain sort of aims and objective depending upon the particular specific pathological condition. Fine. So, for example, if you want to design a screening program for badminton player, so we do understand that shoulder girdle will be working too much and thoracic component will be too much over there. Okay. So we need to focus on those musculature in which the specificity will going to play a role from the sports context, and through which we can able to tailor all these things. Fine. Be it any sort of special test, be it any form of functional test or flexibility, mobility, we need to look upon each and every musculature or tissues over there, and through which we can able to do a certain sort of hypothesis that for example this particular test is going to cause a positive effect in particular injury. So we can formulate hypothesis and all those things, and we need to collect the data, and through which we can able to formulate a particular screening program. But again, it is a tedious work and long way to go on doing all those things. So that's why people are right now much more doing the things other way around. However, assessment, I guess everyone knows. Fine, assessment is basically done to understand any sort of disease conditions or pathological condition the person is having. In that also, we need to understand there are different phases are there. However, we follow a SOAP format. SOAP is basically subjective, objective assessment and plan format. In that also, we need to understand different things also, like collect patient and information and form a certain sort of hypothesis in the starting. Fine, generally we generally think that no, this is the case, certain the things and all those things. But however, we need to have a certain sort of assumptions and hypothesis whenever the patient is coming to us through the any form of subjective assessment and all. We need to design and conduct a safe assessment. Then we need to interpret and analyze the results and all those things. We need to develop a particular intervention plan. Then we need to have implement safe and effective physical therapy practices. We need to have evaluate. We need to evaluate the effectiveness and efficiency of physiotherapy interventions. Then we need to communicate all those things effectively. And sometimes incident reports will be there. So we need to do a risk management, and we need to look upon all those things also. So whenever we say about collect patient informations and hypothesis, we need to understand first of all the foremost thing is that to look upon this component, that informed consent. Fine. So whenever someone is coming to us, we need to go for informed consent, be it any form of the assessment. Fine. Whether it's a sports specific assessment or physical therapy, be it anything, informed consent is the first and much more priority we need to look upon. Then we need to look upon the different forms of history coming from the medical history, surgical history, family history, personal habits, and all those things, supplement sports history. So that is going to give us a brief sort of understanding about a particular person or patient, and depending upon that, we can able to formulate certain sort of hypothesis, and later on we can able to tailor certain sort of goals and all those things. So whenever any sort of patients are coming, so we need to design an assessment in a such a way that it is much more specific to that particular history that we are going to take. All the history should be in the form of open-ended questions, nothing like a closed-ended question, and we need to follow this all methods whenever we are doing all these things. So there are different sorts of assessments are there, like a physical examination we need to do. Before that, we need to look up on the observations. Okay, so there are certain things like on observation. Okay, so on observation we need to look up on things. What are things are there, like a swelling is present or not, how about the posture, gait, and all those things. So for example, if someone is having an antalgic gait, fine, I hope everyone knows that. So antalgic gait is something is wrong with the foot. Fine, so we can able to assume that something is wrong over there. So that is our certain sort of hypothesis in the starting, but going forward with the observation, then palpation, then physical examinations, we can tailor all those things to that particular one sort of diagnosis henceforth. So whenever we're talking about examinations, we need to also look upon the this sort of like a superficial, like a sensory examination in that, superficial one, deep one. Fine. So it is also having cortical and all those things over there. I'm not going to go deep on those particular aspect, but we need to look upon all those things also. Then muscle strength we need to look upon again. Fine. Then apart from that, we need to look upon the functional assessment, and then we need to formulate a certain sort of uh, goals and diagnosis and differential diagnosis prior to that. So whenever we are trying to interpret and analyze any sort of assessment finding, we need to understand, first of all, we need to compare those things with the normal status of the patient. Fine. So what was the normal thing, what it should be in a normal case scenario, and how it is right now differentiated. There's something known as minimal clinically important difference in a statistical point of view. fine. But we need to compare what was the normal scenario and how the things are right now. So depending upon all this context, we can able to see the differences. Like pathological changes, range of motion changes, any sort of muscle strength is going down, flexibility, so any sort of tightness, contracture, deformity, all those things are the clinical representation of any particular pathological cases. So we need to look upon all those things. And first of all, also we need to understand at what patient require right now. Fine. Generally, the thing is that we tend to treat patient from our point of view sometimes, but however, we need to understand what that particular patient require from his point of view. Fine. So what is the whenever we are trying to look upon any sort of disease conditions, we need to look upon all those things also. Again, after certain days, we need to reevaluate all those things. So that's why outcome measures are much more important. So outcome measures are in the form of like NPRS or VAS or ROM. So these all things are simpler in the nature. We need to look upon. However, we can look upon certain sort of subjective questionnaires also, like LEFS or SPADI, DAS. They are different depending upon the joint. So this all indicators is going to make us understand the progression of a disease or rehabilitation in a much more better way. And it is like a data driven approach. Suppose, for example, if one patient is coming to you as of now and he's having a pain of 10, so you are recording all those things in the form of any things like I would rather say we can use Google Forms if softwares are not there. So if we can look up on Google Forms and we can track, we can make a metric of our own things like that, like a special test, which special test is positive, negative for that particular case, any sort of subjective questionnaires, as I told, like LEFS or Avestry or SPADI, DAS. There are so many. Fine. So again, it depends upon the specificity and sensitivity of that particular test and forms. Fine, because we need to understand false positive, true positive, false negative, and all those things like a confusion matrix. Fine, so that I will discuss later on, something about this confusion matrix, sensitivity, specificity, accuracies in some different this discussion. So that's why outcome measures are important whenever we are trying to do any sort of rehabilitation or be it screening also fine. Screening also we are designing any sort of forms over there if we are trying to put over there any sort of mobility test, fine. And if you are going to track all those things, so this is not only going to give you your confidence as a therapist, but also the patient will be aware about all those things, that there is certain sort of progression is going on in the form of outcome measures. Fine. So we need to have a certain sort of logical rationality and scientific in nature. Fine, before coming to any sort of planning and selection of any sort of treatment plan, it has to be any goal should be like a SMART principle, like a specific in nature. It has to be measurable, achievable, realistic, and time bound. Fine. So that is much more important. Then any sort of in any sort of problem that is arising at the instance of any intervention, also we need to look upon all those things, and we need to look upon in such a way that why this is occurring. And sometimes happens what we are trying to do certain sort of treatment in the form of exercise or electrotherapy, and that is causing a much more discomfort sometimes. So we need to look upon and dig upon all those things and see what is the root cause. I would rather say in each and every scenario, so we need to treat the root cause rather than a symptom. Fine. So if we say any sort of musculoskeletal condition, so root cause will be more or less the tightness of a muscles, any musculature group or weakness, causing a much more error of changes over there, or there will be so much changes in our body. Fine. So if we are trying to work upon strength of that particular musculature or flexibility and mobility of those areas, so we can able to cause certain sort of physiological changes. Fine. So whenever you do any sort of activity, the blood flow is going to increase. All these changes will going to occur. So that is going to cause drainage of wastage product or pain producing agents like prostaglandins, interleukins, and all those things. Fine. And sometimes there's also release of endorphins causing this all changes also. Fine. So this was all about assessment and screening. Fine. So we can discuss about this all things if someone is having any sort of queries. Thank you so much for your time. Anyone is having any queries? No one is having any sort of queries. Everything is clear. Suppose so there is one case study. Fine. So I will try to discuss, and in that, if someone wants to look upon and think, fine. Generally, I used to discuss all those things. Suppose a patient is coming to you, fine, with a history of some sort of radiating pain that is radiating towards the bilateral palm or something like that. Fine, is in your medial aspect, so that we are able to make certain sort of thought in our mind that something is going wrong with the nerve. And if it is a medial side, fine, and on the medial side on the anterior aspect, so like a palmar aspect, so we can able to assume that it is a median nerve. Fine. So due to which now we can ask a certain sort of historical questions, that if person is a sportsman or some sedentary person, the patient is now we can able to connect the dots, that is, see, the person is having this sort of pain, so it is a nerve pain. Now that particular person is a sportsman, for example, for right as of now. So if the person is a sportsman, so he must be training for a longer interval of a time, maybe depending upon the sport. So maybe upper body workout is 2 months, causing some sort of tightness in a upper body musculature, can cause some sort of nerve irritation over there, leading to this pain. Or maybe the person is having a much more intake of protein, and protein end product is urea and uric acid, and that is causing some sort of peripheral neuropathic changes. And so these are the two scenarios in which the things is so much in a correlation that we need to look upon different aspect. Fine. Clinical decision making is about looking the things from different angle. Fine. So that is why whenever we are trying to do screening or assessment, we need to look the things from different viewpoint. Okay, so that's why you need to ask question about nutrition also, sports also, training also. So history is much more important whenever someone is coming to us for any sort of treatment or rehabilitation or injury prevention program. So because if we don't know certain aspect, fine, and then the things will be in our understanding will be limited. Fine. So if we don't know that the person is having a too much of protein diet or something different he is doing, that can cause some sort of different physiological changes, and that can also lead to certain sort of pathological changes. Fine. So we need to look the things from different viewport and then come to one sort of conclusion. Then also we need to look upon the different sort of differential diagnosis. Fine. That is also much more important, because one thing can mimic the condition of other also. So we need to look upon the things in different angles. Fine. And in case of screening, so there are so many programs are right now available. People are doing for that injury prevention program, and that is much more tailored towards that only, that we need to look upon the particular sports, and that particular sports is having a specific needs and demands of any musculature or any sort of regions over there, and due to which we need to make our screening program in that way only. Like for example, badminton, I gave the example in the starting. But right now look upon like a team sports like a football. We need to make a program for a defender in a something different way, midfielder different way, striker different way, and goalkeeper different way, because their specificity is quite much more different, and the demand of that particular musculature will be much, however, different. So we need to look upon the things in different perspective and then design a program in case of screening. And whenever we are doing assessment also, and we need to look the things from different angles. It's not about that the person is sportsman, fine, so we need to understand history, what position, what player, and since how long he's playing, what is the physiological adaptation he's having, because this all series of events is going to cause a physiological changes. And if we try to miss any of these dots, then the rehabilitation regimen will be somehow not I will not say not that up to the mark. Fine. So we'll try to miss, and again the reoccurrence rate will be much more. Maybe. I'm not so sure about that. Fine. However, we need to look upon different angles and viewport. Fine. So anyone is having any questions, anything? Fine. Or you want me to give any other sort of examples, anything? Fine, then if not, then we'll wind up. Okay, then thank you so much for your time.